Nobody experiences health in a vacuum. We experience our healthcare in the context of our access to public transit, to green space, to quality education, to a safe place to. So ultimately, when we talk about populations getting healthier, we're really not just talking about health, right? We're also talking about how do we improve their quality of life. And health is just one factor through which a person's quality of life can be improved. The medical system is almost obsessed with women as childbearers, as if they have no other identity. And we know not all women want to give birth. Not all women do give birth, but that's the primary way in which our society thinks about women. But I think this real obsession with women primarily as childbearers before anything else has really limited what the medical system is able to do for women as far as research, as far as clinical trials, as far as actual clinical care is concerned. There's been so much more conversation about the mental load, the work that women do to run households that is often invisibilized, not paid, and often taken for granted, whether or not those women are in the workforce or not. So when we're talking about access to health, it's really important to also think about how if you don't have access to other things, you also can't access health, right? If you're not listening to the stories of medical gaslighting that happen to women and believing those stories, we won't really meet our objective with improving women's health. I think it's important to talk about that in the context of what everyone has been discussing, which is universal healthcare. Like, what does it mean for every single person in this country to have coverage or to have access? And what I find really fascinating is it has a lot to do with our identity as a country. And I think in the United States, we really pride ourselves on choice.